his memoir. It's on the link of the poster, and we're going to put it on the school website, and we'll also be publishing it in the University of Victoria Library. So if you have a chance, it's amazing. There were so many things I did not know about Denis until I looked into the memoir. So before we go, I just want to say where we are today at the school to see where we came from. Right now, we have about 1,000 alumni. Many of you are alumni from the programs here. We ramped up to about 10 core faculty, over 50 adjuncts from around the world. We have a steady state of about 200 undergraduate students in health informatics exclusively, and somewhere between 50 and 100 graduate students.
Wow.
So things took off and it's gone well, but it'll be interesting I asked Denis to initially just talk about how it started. There are so many different aspects to his career, but where it all began and what were some of the roadblocks, how he overcame them, and then how he came here and began this wonderful experiment that has taken off. So I think most of you know a lot about Denis, but if you don't, he was the founding director of our school in 1981. So that makes it now the 40th anniversary. So we have to do something special. It occurred to me that now it's 40 years now. That's amazing. And our faculty and universities behind us, our enrollments have just gone straight up, and it's been great. He's also a founding member of COPES, now Visible Health Canada, second president, and was founding member of so many other organizations like American Medical Informatics Association, a member of the British Computing Society, and a founding member of the International Academy of Health Sciences Informatics. And as you know, he has hundreds of publications and books and journals, and there's advice around the world. I know about his work. It'd be nice to hear more about with the NHS in the UK. Remember him working in Andalusia, bringing a whole team. We'll talk about teaching, but how he brought that to our school, even with a translator booth. I remember that in one of our grad courses. It's just been amazing for him to be bringing all this to our school. I remember he told me once about his research plan to visit Italy, Spain, I think it was Greece, and all these countries. And I thought, what kind of research is that? And then he came back with an amazing comparison of all these countries. And I did some follow-up on that the year after on my sabbatical to get some good travel in. But just amazing, and connections all over in the UK. He's an honorary doctor from CBU, where Abdul used to be, and many awards, too numerous to mention. So I think what I just asked Denis was first of all, what we talk about, I think how it started here, but if you want, we can go back before that. I know you have a long history in Winnipeg and World Jubilee Hospital, and yeah, I'll just get us going. And then what we'll do is that we can have a discussion. If you want, just raise your hand, use your mic, or on the side. I think Andrew was going to monitor the chat, and Sandy, or just chat in the chat. So I'll just, with that, pass it on to Denis. But I do say, please read his memoirs. They're really fascinating. Yeah.
Thank you, Andre. Thank you very much for that. As Andre's requested, I'll give you a quick history of the school for those of you not familiar with it, to give you some context of where the school started. The history of the school goes back to the mid 70s, where there was a medical records program at a small university in British Columbia called Notre Dame University, same name as the famous one. And there they were training medical record librarians, and the medical record librarians, of course, were the ones who were doing the coding. the coding of hospital records in ICD, International Classification of Diseases, to submit to a collection agency, which was HMRI in Canada. That program lost its accreditation.
Where's that car back?
Yeah. They lost their accreditation with the Medical Records Association. And about the same time, the university decided to shut down the entire university. So the medical records group were encouraged to make a proposal for a program at UBC. And they did. They submitted a proposal. And the proposal went to the medical school, the medical college at the University of British Columbia in Vancouver. They turned it down. They, for a couple of reasons. One, that it was not academically rigorous enough. It was more of a technical school program. It included a course in typing as one of the courses. And the other reason was that was brought out, okay, well, the medical school committee turned it down. The chairman of that committee, Dr. Nilsson, was also the head of the epidemiology department at UBC. And he wrote a rather stinging letter afterwards denying the fact that this program was not worthy of being a university program, and said in his letter that the only reason they turned it down is because the doctors didn't want anyone around who was going to be looking into their affairs and counting things. Anyways, the chairman of the university's commission, at that time there were 3 universities in British Columbia, we're still in the mid-70s, UBC in Vancouver, Simon Fraser, and University of Victoria. The chairman of the commission was a retired neurologist who saw the potential, saw Dr. Nilsson's letter, and also saw the potential. And he convinced the president of University of Victoria that they should really look into this. And he suggested that they drop the word records and switch to information. So talk about medical information, not medical records. The committee was put together at the University of Victoria in the towards the late 70s. And they started looking at, and they put together a program called Health Information Science. I had arrived in Victoria in '79 to take a job at the Jubilee Hospital, but also to take a part-time job teaching in the graduate school in public administration at the university. So I was put on that committee. It was added to that committee after it had been formed. And we eventually submitted a program to the Senate that was approved. Now, the program was more or less an epidemiology program. I felt that there wasn't a big demand for people who had an epidemiology-oriented training. And I felt there was the need for people who did the kind of work I'd been doing for the last, I guess, 12 years in Winnipeg and at the Victoria General, at the Royal Jubilee, where individuals have been trained in computer science, who had some understanding of healthcare and medicine, and who understood management systems. So eventually, that program was eventually approved by the Senate after some fighting, but it got approved. And we unfortunately were at that time, we're now in the early 80s. And that's when the global economic recession hit around the world, and particularly hit hard in North America. So there were cutbacks everywhere. And the university wanted cutbacks. And we were prime targets to be cut back, to be cut out, not cut back. I was the only faculty member and one secretary. We only had 30 students at that time, and we had just started teaching. So I was called to a meeting with the vice president and Mr. Murray Fraser, and he basically was telling me, this was a November meeting in 1982, I guess, that the program was going to be shut down. I was able to convince him that we could operate one more year without any additional funding, because our students, our cohorts of students, would be going out on 2 co-op work terms over that year, and we would only have to be teaching in 1 term and not teaching in 3 terms. Fortunately, and to this day, we still owe a huge debt of gratitude to Murray Fraser, who agreed and said, okay, you can stay around for another year. Over the course of that year, there was enough pressure put on the university by the Deputy Minister of Health, and with an agreement and cooperation by the chairman of the board of the University of Victoria, that we should not be cut, notwithstanding the economic recession. So eventually we were released from, and during this economic recession, we lost all of our earmarked funding. We were guaranteed 5 years of funding to get the program up and running. We lost that after year 2. So we now had to fight for our survival along with all the other established programs and departments in the university. And we were the newest and the youngest. We fortunately survived those days. And we fortunately were, I guess it was in 86, 85, 86, given the go-ahead to start adding new faculty, which we did. And that's when my colleague Jochen Müller came over from Germany and joined me. And we built the program from there. So I think that's good enough, Andre?
Yeah, just one other one before I open it up. How you came up with the curriculum, because it was so innovative, having the 3 pieces of management, health science, and IP that we're still working from today, although modified.
Okay, right, I forgot to mention that. Basically, I sent a letter out around the world to Jochen Moore and John Anderson, Don Lindberg, Morris Collin, all the various people. Marion Ball, I think, got that letter, if I'm not mistaken, and asked for advice on what we should do. I got some responses back, especially a long response from Joachim, who was running a new program, I guess 2 or 3 or 4 years old in Heidelberg, Germany, which Reinhold knows all about. I also studied the suggested curriculums from the American Computing Machinery. I think it was ACM, I think American Computing Machinery.
That's right.
Who had a proposed PhD in management information systems. And I liked the balance of that curriculum. It had computer science in it, which we didn't refer to as information technology in those days, computer science. It had some management courses, economics, statistics, but it also had healthcare courses. And I thought that was the mix we needed. People who understood something about the healthcare system, particularly the complexity of it, and who had technical knowledge with technology, and who understood general systems and how to put systems together. So from that, and with Joachim's help, we massaged the curriculum. We had difficulty getting it in. The Senate didn't want to prove it, partly because I was taking out courses that they had seen in the original curriculum that would benefit their departments. Like I took out a biochemistry course, and of course the biochemistry department wasn't happy with that. I tried to insert a theater course. I felt strongly that what we needed were individuals who could communicate and communicate in a variety of ways, not only in writing, but also in orally. So I had a proposal for a theater course, which unfortunately we never did manage to pull off, but we did put a stress on communications in our coursework for well, from day one, and I'm assuming it's still there. Our students were notoriously reputation for working in groups, not alone, because many of their projects were group related, and they were notoriously effective in presenting, so that they were required to present their findings, develop their presentation skills, and we always got a lot of positive feedback from employers as to how well our students were able to present. So it was, to wrap that up, Andre, it was a question of the advice from various people around the world, but probably more what I saw in the ACM proposals for, instead of a degree in computer science, a degree in management information systems.
Oh, fascinating. Yeah. So we'll just open it up. If you have questions you want to ask Dennis, you could use your mic, or you can raise your hand. I think Andrew is monitoring that. Yosh, right off the bat, yeah.
Hi, Dennis. I enjoy your initial presentation. I'd love to hear more from you. But I was wondering, I ran through your history of your life, and I missed Jan van Bemmel. And I remember that he was certainly in the 80s, very active with trying to establish some kind of educational model. Did it have any influence on you, or were you not aware of that, or were you actually sitting in separate worlds?
Thanks, Jas. I never spent a lot of time with Jan van Bemmel. I mean, I'm well aware of him, and I met him, and we had a number of arguments. If I recall, he and I were on different sides of the fence when we went through the stage that we started to try to introduce the notion of health informatics instead of medical informatics. And Van Bemmel was very strong on the medical informatics side, and I can remember at one conference having quite a heated discussion with him that I felt that there was a broader picture than medicine, particularly in North America, where medicine had a connotation of being physician only oriented. And I felt, well, already by that time, I think this is probably the late 80s, that we were dealing with a broader issue where medicine was a critical and probably the most important part, but only a part of the healthcare system, and that there was a lot more involved, such as nursing, let alone pharmacy, let alone governments, departments of health, let alone epidemiology, and so on. So we had a good chat, but it was not a chat that it was heated argument, but it didn't stop us from having lunch together and spending time together. But he was one of the international colleagues I spent less time with for whatever reason. I have no idea to suggest why, than some of the others who I spent more time with.
But you were definitely from different worlds, as I see, because he was really from biomedical physics and was in analog computing, and you have been kind of sitting on in the world of hospital administrators, or trying to organize hospitals, right?
That's right. I mean, when we started, the focus was hospitals, but we broadened that focus to include other aspects of the healthcare system beyond hospitals. Yeah.
And I just wanted to say, I think that covered the way we look at it in Canada, because we sort of see health informatics at the top as health being very general, with clinical informatics under consumer under, and the whole COPES and Digital Health Canada, I think grew, well, I was on that committee, it grew from the curriculum that I learned about from Dennis. So it kind of covered the way we were looking at it in Canada in general. Yeah.
It's interesting. No,
oh, sorry. Oh, I think Mike's not on.
Okay, can you hear me now?
Yes.
Yes, we can, Mary.
Okay, first of all, I want to say the influence that our good friend Dennis has had at least in our country, the US, on the level of health informatics was actually just phenomenal. Because of a lot of things that he did, and we had a fantastic meeting in your university. It's got to have been in the late 70s or 80s, and you published a whole proceedings of that where all of the leaders were there. Many of us, we started nursing informatics programs at the University of Maryland, where I was taking exactly the kind of work that Denis has done. The University of Maryland College Park, where they have a health informatics program, all of that was a feeder from what Denis has put into the curriculum. He was really, and still now was the first person ever to have an undergraduate major in health informatics. I mean, you could go to many universities, they have woven it into the curriculum, but who has made that an undergraduate degree in health? As far as I know, no one to the extent. So, I mean, hats off to you, what you've done for our field and your diplomacy and places that you've had influence in the meetings in South Africa that you took part in, the influence that you've had, particularly in AMIA, at SCAMC, at all of the meetings. Also, as you said, with what you did with the IEEE, all of those contributions are mind-boggling, and we owe it to you and to Canada. Canada has truly been the leader in all that, and a lot of the work my good colleague and friend Catherine Hanna, who I see is on the call as well, all of the work that you've done is referenced in all of our books on health informatics. So really, if nothing else, a thank you for what you've contributed and continue to contribute. I mean, I'm now at the University of Texas in Arlington, Texas, with an interprofessional center for health informatics. And the health was what made the difference, in all difference to our good friend and colleague, Jan van Bemmel. So thank you from the bottom of my heart. Really think you're a great guy.
Thank you, Marion. Thank you.
Yeah, I think that's a very interesting point, because at UVic we have a bachelor's, 2 kinds of bachelor's, 3 kinds of master's, and PhD.
It's
so
amazing.
As far as I know, I don't know everywhere else is either undergrad or grad. I haven't seen that anywhere else.
Still are the leaders. You're still the leaders, still number one.
Okay, other questions? I have a few more myself. Let me check. Oh yeah, we have Amanda Joseph.
Hi, thank you, Dr. Krishnak, for putting this on, and thank you so much for blessing us with your presence, Dr. Protti. I'm a huge fan, as we all are, so echoing those sentiments, thank you for being amazing. I'm currently a master's student on my last semester at UVic in health informatics, and I've just applied for the PhD, and I'm also a recipient of your award, so thank you to you and Pat for your honorary award. What an honor that was to receive that in the 2019-2020 section. So my question to you is, what would you have, what kind of advice would you have for new graduates and new PhD students, factoring in all of your vast experience? What kind of broad advice would you have for us going out into the world?
Okay, well, I guess the first thing that comes to mind is look outside your own walls. In other words, look beyond the people you studied from. Look beyond your world, be it Canada or the United States or a given country, and look at what else is going on around the world. And don't be afraid to seek advice and help from colleagues around the world. Attend conferences. I'm thankful to one of my first mentors, probably my first mentor, Dr. Michael Saunders, who was the head of the department we created, the Computer Department for Health Sciences at the University of Manitoba, which back in, would be in '67, to support the computing efforts at the medical school and the dental school. And I started working with him in, I guess, May of '67. And he sent me away very quickly. He sent me to conferences all over the place, mainly in the States. I don't recall going to any in Europe at that time, but mainly in the States. And he was a firm believer that I would do a better job if I understood more broadly what was going on and not just focus all of my energies on the medical school and the dental school at the University of Manitoba in Winnipeg. So I benefit from that. And I benefit from knowledge I gained at innumerable conferences from innumerable people like I'm seeing on the screen, Francesco, Sala Mandela, WHO. I learned a huge amount attending conferences that he organized and brought us to Geneva. That was a tremendous learning experience. So I guess my primary advice to new graduates is, number one is look and study and learn from others who have been down that path. I guess my second major advice, and it's probably, I was asked when I retired, do you have any regrets? And I said, I had one. Yes, I had one major regret. It's a life regret. It's not a informatics regret, but is that I was not brought up. When I studied, the only thing that was important to me was mathematics. Starting in junior high school, and university. And I downplayed the importance of anything in the liberal arts, mathematics or chemistry, but nothing related outside in the arts. And the big regret I had, still have, is I lost the opportunity to study history. I lost the opportunity to understand history and understand how history has affected us. So I came to realize that, I guess, when I started teaching mostly, and I came to then tell students, understand the history of where you're working. You'll be much more effective if you're working, say, in a laboratory of a hospital, to understand the history of that laboratory and understand the current, both the past history of the laboratory and the current history of the laboratory. And it'll make life a lot easier for you if you understand that and devote some time and energy to that. So that's my second piece of advice. Understand the environment that you're going to be working in, and understand how that environment, how that organization got to be where it is. And there's probably some tips that are useful in that, and that you'll be able to work more effectively with that understanding.
Thank you. Awesome.
Great. And Reinhold, and then Zanis, and then Michael. Reinhold.
Thank you, Andre. First of all, Dennis, also congratulations from my side. What you did, this is what Marianne said, it's simply wonderful. And I think many of the people of today, they cannot imagine what that meant, 50 years ago, to start such programs and to have these thoughts, combining healthcare from different views. Yeah, what you mentioned, the views of physicians, the views of nurses, the views of the administrators, bringing that all together and bringing that beyond institutions like hospitals, what you also said, yeah. And that was great. And this was all in your mind. Yeah, and you feel that, and this is what now still can be seen at UVic, where you have now wonderful younger colleagues, yeah, who continue your work. Let me just say this, and my sincere congratulations. 50 years ago, I checked that I was still at school. My beard is longer than yours, yes, yeah, but but in any way, I thought I should explain a little bit about two things which have been mentioned here. Yeah, you said it is the first undergraduate course, and you're right. You should also have in mind that in the European tradition, in many countries, until the late 90s, we had joint bachelor and master degrees. Yeah, and these were called diploma. So diploma has a completely different meaning in other countries. Yeah, and that was from the 2000s on, or late 1990s on, when we then distinguished, separated the two parts, and having bachelor and master. And so just as a comment, the Heidelberg Heilbronn Medical Informatics program that started in 1972. Yeah, I was one of the students in 1973. Yeah, somebody told me about this strange program with strange content. Yeah, and so on. Yeah. And this is why there was no undergraduate, at least in countries like Germany and so on, not in the Anglo-Saxonian. Yeah, and maybe if I can also add that, as Jan van Bemmel was mentioned, I have to add the first Dutch program was in Amsterdam around the early 80s, a little bit later, like than the UVic program coming. It was in Amsterdam, not in Rotterdam. The term medical in the Dutch meaning and also in the German meaning is much, much broader. Yeah, so it is similar to health, so to say. And this is why it was very difficult for me also to learn why some people on the other part of the world, they just combined it with physicians. Yeah, I had to learn that. But that was simply the background, probably also with Jan arguing in that way or with others. Yeah, but once again, my sincere congratulations, and you can be really proud to look back to 50 years what you've done. I know that you are a singer, and you will suffer for about 1 year not to be able to sing anymore due to this strange pandemic. Yeah, hopefully we can do that later once again. My sincere congratulations. Thank you.
Well, thank you very much, Reinhold. It's very kind of you. Thank you also for bringing out those dates. I probably underplayed the history of the German programs as being ahead of us by probably maybe close to 10 years in terms of the ones. And I was fortunate to steal Joachim, who was your professor, I guess, and bring him to Canada to our greatest benefit. But I know that I visited, as you know, I visited Germany a number of times and lectured there, and got some friendly ribbing from my German colleagues who said you stole one of our stars. We don't like you, but they were just kidding. But anyway, but thank you for that. And Reinhold, thank you also for your leadership. You've been doing an amazing job with our new international body that was just formed a couple of years ago. And as our first president, you've done a fantastic job. So we thank you very much for that. All of us on the screen who are part of that body, I'm sure would join me in thanking you for your leadership.
Okay, I think Zamas was next.
Hi, everyone. Hi, Dennis. I loved reading your history document, by the way. Fascinating. I'm a graduate from 2001, and I hope this isn't disappointing to you, but I've never actually worked in health informatics after I achieved my degree. I'm actually a project management consultant to pharmaceutical companies. But I just wanted to tell you that I have probably used absolutely every aspect of everything I ever learned in the Health Information Science program in the work that I've done over the last 20 years. From understanding programming to knowing how to present. And I actually believe it has been really integral to the success that I've had in my career. So thanks for designing a program that created a rounded individual, shall we say, and a skill set that is valuable across many, many industries. It was just so interesting to go from things as maybe pedestrian as medical terminology to medical ethics. I wish I had been able to enjoy it a little bit more, simply because I was always worried that I was going to fail my next exam, but it's a wonderful program, and I really thank you for being so integral to making it what it is.
Thank you very much for that, Janice. That's very kind words, and very, very much appreciate it. You triggered that one of the courses we had a little difficulty getting the Senate to approve was a course on legal matters in healthcare. It wasn't taught by the law or faculty of law. We have an excellent faculty of law. It was taught by a lawyer who worked for the Ministry of Health, and he as a sessional taught the course. And he often brought in a medical ethicist as well. So the students were exposed to medical ethics as well as the many other facets of law in healthcare.
Yeah.
Thank you for that, Janice.
Yeah, Michael.
Well, hi, Dennis. And first of all, what an overwhelming show of support for you and all you've accomplished. For those of you, many of you I know, Dennis and I go back a long time. I think I was in my mid-20s and maybe you were late 20s, early 30s when we first met way back in the day. We both had a lot more hair, I can tell you that. You have inspired so many people, including me, and I just wanted to publicly state that your influence has been phenomenal on me and the entire industry. I read your memoir twice, it reads like an anthology of the industry, and I think it has huge value to us to know where we've come from, and indeed where we are also maybe going. I actually have a question for you. You said to me many years ago, decades ago, something that I attributed to you. It may not be your line, but I've always attributed to you that our industry is undergoing a journey and it's not a destination. And you can say that you got that from somewhere else, but I got it from you. And so my question to you, Dennis, is you sit back and look at what's going on in health informatics, where it is, where it's come from and where it's going in the future. I'd love to hear your thoughts on the journey as it continues and where it's going to lead us, primarily to the generation that's behind you and I, many of whom are on this call.
Yeah. Well, Michael, I picked up the destination versus the journey somewhere in England. And it wasn't referring to our field, it was more referring to what we were calling the electronic health record. And I suspect John Farrington probably was the one who might have influenced, might have even said it. I can't remember, I'm sorry. But it pointed out, and I used it a lot, it pointed out that the automation of the healthcare processes that we're trying to work on and improve all the time will always be changing. There's no point in sort of trying to say we're there. We'll never be there. It's a question of applying the technology more and more effectively. And with the electronic health record, the thinking in England, I can remember, was that, once we have it, we'll be done. And I and others in England tried to get the message out that the electronic health record is one piece of a journey that is helping us improve the quality of life, particularly not only the quality of life of our patients, but we began to realize the quality of life of our staff, of our doctors, of our nurses, of our pharmacists, of our social workers, and so on. And that the use of technology is hopefully improving their quality of life as well. And I can't, I have to admit, I am not giving much thought, my friend, to where we're going. I stopped working in the field in 2017, and I was working maybe 20 hours a week, still doing research, still consulting, still writing some papers. But I decided to shut it down, so to speak, for good. So I'm not very knowledgeable about what's happened, other than what I pick up here and there superficially since the 2017 area. So I see these little articles on artificial intelligence. I get accounts of how technology is being used in COVID. I read some of the stuff that our international group puts out every once in a while, but I don't read it deeply. because I'm devoting my energies to genealogy right now and not to informatics. So I'm afraid I'm not the one to ask as to where the field is going. And I would think there are a lot of people on this call right now who are still active. Look at Marion Ball, she's still active. And she probably, and others, like Francesco and Sala, and those kind of people will probably be the better ones to ask as to where the field is going, as opposed to where it's come from, which is what my focus was on that paper. Sorry, Mike, if that doesn't answer your question.
Totally great, Dennis. Congratulations.
Jennifer.
Hi, Dennis, and all the other great minds that are in here today. You attribute a lot of your advancement and opportunities to your mentors and your teachers when you were starting off. And I'm still very early in my academic career as a second-year health informatics student. But during this completely online experience, I'm finding it difficult to find a mentor like that. I was just curious, maybe if you could tell us a bit more on how we develop those relationships and be able to be guided in the same way that you were.
It's a very interesting question, Jennifer. I don't recall, and memory is not one of my strengths. Those who don't know me really well know that I don't have a strong memory. But I don't recall ever going to search for a mentor. I don't ever recall going and saying, please be my mentor. I just, in the course of life, ran into people who became mentors. And similarly, I've been told by others that I became the mentor of people as well, but they didn't come out and ask me, be my mentor. It just evolved. My first mentor was Dr. Saunders, a wonderful Englishman at the medical school in Winnipeg. And then my next mentor became a man by the name of Tony Quaglia, who was the president of the hospital. Turned out he became a very close personal friend. He was my next mentor. Dr. Ken Thornton at the Royal Jubilee Hospital in Victoria was a very, very influential mentor to me, extremely influential. And he was just a chap who interviewed me when I was applying for the job at the Jubilee Hospital, and was in a position to, very influential inside the hospital, was in a position to say, out with you, there's no way you're going to get this job. But he supported me in my application, and over the years, for the next probably 5 to 8 years, was a mentor, as well as a teacher, and again, he became another very close personal friend. So to answer your question, Jennifer, I don't think there's, and I may be wrong, if others want to comment, I don't think it's a question of going, you can perhaps see someone that you would like to act as a mentor. I can remember some of my colleagues through various parts of my career also acted as mentors and gave me very, very sound advice. They don't pop up in my brain as highly as some others did, but they still were there and they provide. So I guess my advice to you is look around and get to know people around you, particularly people who are older and have experience, and maybe they'll become a mentor. You can ask them. You can ask them for help. You can do that. But I don't think you ask them to become a mentor. And I may be wrong on that.
Yes, that definitely makes sense. Thank you so much.
KB.
Hello, Dennis. So I will say 20 years ago this year, I started in the HIMSS program, and you certainly were the most influential of my professors back in the day. Julia, who's on the call with me, and I were laughing, saying we needed to do our reading because you might call on us. Back in the day, you had your deck of cards where you'd call out on students. If you had to be ready, we knew what might happen. Also, with Michael's comment, I actually sent a note to Mike Greer last night saying I was attending this and saying that in my closing comment to him, I laughed that one of your exam questions was, is the EHR a destination or a journey? So there you go. You've given us the right answer today. So my question for you was, your classes are very, very practical. I found them very real world and very tied to what we really needed to know when we started our careers. And as I started, I reflected on them often, but they were practical often because of the guest lecturers you brought in. I wonder though, to what extent did you know what they were going to say to us versus you were just finding people you knew were knowledgeable and hoping they'd fit into the topics sort of that you had for the course? Like it did feel like a very vast array of people you brought in, and what they spoke about wasn't always fully tied to the topic of the course, but super helpful in learning about it. What was your strategy with your guest lecturer crew?
Okay, thanks, Katie. Nice to see you. Looking good. I don't recall, and again, I may have, but I don't recall guiding the many guest lecturers that came. And maybe we'd get Roger Gerard later to make a comment if Roger's still here, because he was one of the guest lecturers. I don't recall guiding them, but I told them about the course, obviously, the course outline. I gave them the course outline. They could see what, and they could see where they fit in the course outline. I might have on occasion say, would you particularly talk about this aspect of the topic? But I don't recall being very definite. And I just chose people who I pretty well had always met that person somewhere before. And in the course of conversation with them, thought that they would be an ideal candidate to be a guest lecturer. I particularly remember the young man he was from Denver, Colorado at the time. We were together at a small meeting in Chicago, and he so impressed me. He just blew me off right after he spoke, I went up to him and I said, "You've got to come and lecture at the university." And he was a data warehouse specialist, electronic data warehouses. And Dale Sanders, and I'm still in touch with him. But with someone like him, I would just say, come and talk about the electronic data warehouse, please, in healthcare, which he had experience with in Salt Lake City. Actually, Salt Lake City, wasn't it? So
on Dale Sanders, Dennis, I later did consulting work for him, and it was entirely prompted by saying, I was Denis Protti's student. And he said, "Oh, well, then you must be an expert. I'll hire you." So thank you for that.
So I don't recall. I just, they were all, from what I can remember, again, I'm pretty sure they were people I met. I don't think I cold called anyone and said, "Would you come and lecture?" Even though I don't know you, but would you come and lecture? I don't think that ever happened, but it might have. I don't know if Roger wants to make a comment.
Dennis, thank you for that. I don't recall you giving me, anyways, any direction or anything like that. We knew of your program, of course. By the way, for the group here, I'm probably the one that's been around Dennis. We've been intersecting for longer than most, and possibly everyone else. It was in the early 70s, I think, when we connected for the first time. So we knew each other for a long time. My background has always been in shared services and the concept of bringing together. Back in those days, you'll recall every hospital was a silo. And I think you were asking me to come and talk because it was, at the time, I was either in Manitoba or in Quebec or in Ontario somewheres, and was always involved in some way of trying to bring people together. The concept being we're stronger if there's 40 hospitals in a group than if there's every hospital is on its own. Anyways, I always was delighted because it gave me the opportunity to play golf in the wintertime. And Montreal, Quebec, and Manitoba, and all the places I've lived don't permit that. So, but all Dennis would have to do is we've got a warm bed for you, and you come and tell us what you think is important. So, and that was it, Dennis. That was really no guy. I don't know if you kept asking me year after year, so I guess that was the good thing, and I always really truly enjoyed it. Thank you for that, and it's wonderful to see absolutely everybody on this call. So thanks again.
Roger. Thanks, Roger.
And that tradition continues. We often have guest speakers, and Denis brought that in, and it's wonderful. We connect up now on the Zoom with the world. Nancy, I think you had the hand up.
Hi. Oh, I'm so honored to have the opportunity to be here with everybody. And thank you, Denis, also for being also my first teacher in this space and my inspiration. And for all the speakers that did come, that was just the biggest part of the learning and definitely a launching point for my career, because just like we just heard, it was very possible to be able to say I studied under Denis or under Francis Lau. And that was a very good door opener. I'm curious, now that you're not in the space on a regular basis, I'm wondering what your thoughts are as a consumer and where you see the health informatics going from the consumer perspective. What is it we need to think about when we're thinking about working with people in your own age category? And what advice can you give us looking from the consumer perspective? We were really focused at the time on providers. So that's where I'm curious.
Well, thank you, Nancy. Nice to see you. I see your name everywhere. I remember seeing your name over the years everywhere, so you've done well. As a consumer, fortunately, I'm not, I'm relatively healthy, so I haven't had a lot of interaction with the healthcare system. A couple of new knees, but those were fairly brief interactions. I can't say I see a lot of progress from a consumer in terms of the impact of information technology on my life. My doctor, our GP, has his own system. I can access my lab results online, but I don't see the integration between systems, say between the hospital records and the access to the physician's records. I just read, someone just sent me some material about Israel and how connected they are, interconnected they are, and the fact that one of the reasons they're able to move so quickly on their vaccination program is in part because of their advanced electronic health record, which they have on everybody and which everyone in the healthcare system can access, much as they can in Lombardia in Italy. For years now, they've had access. Everyone in the system has access to the medical record. I would expect that I joined a research project here at the university for seniors, and they're trying to measure the impact of exercise on mental health. So I've had to go through the Mindy mental exams, which are tough to remembering things. But the technology is all online and all Wi-Fi connected. So I get up in the morning and step on a scale, and scale measures my heart rate and my weight. Don't know how it does percentage of blood or percentage of water in my body, but it does. And that goes to the university. And then they gave me a watch, so I wear a Fitbit kind of watch, and they're measuring my steps and heart rate and stuff. And then I go to bed at night, and there's a sleeping pattern on my mattress, and then they're measuring my sleep. That's all connected. It's all interconnected. And I can only think that what little I see sometimes on various programs in terms of technology in the consumer space, that's going to increase. Like I can remember being in a lecture, decades ago, where a lab professor said that if eventually we will be able to have lab equipment that people will wear, which will monitor all the things we do now by taking a blood sample. I don't think that's arrived yet, but I can remember that. So I guess just to wrap up, my personal experience with the technology and systems hasn't changed much since when I was working in the field, but I suspect it will probably in the years ahead as I age further and further.
Thank you. That's really interesting to hear what you're experiencing.
Time for one more, Jerry.
Thanks, Andre. I just want to build a bit on what Marion said and Mike Newsbaum said about Denis as an influencer, and I as a representative of that first dozen graduates in 1987. I have to say, Denis, I don't think you can overestimate the influence you've had on the individuals who've been through the program, both professionally and personally, and enabling to build careers. I know I wouldn't be where I am and have had the experience I had without being part of that experience. And by the way, you did a great job of keeping the lid on the fact that we were almost going to get shut down, and keeping things going, and well done. The influence as well of all your grads on all of the people they've encountered, the growth that they've experienced in the program by being able to communicate. I really, really appreciate, and in your memoir, you do influence the human factor. You emphasize the influence of the human factor and how important it is to the success of what we're trying to do as developers and managers of information systems. I'm also pleased to say that it's an honor to be contributing to this school as a teacher of the legal issues class, and there's no shortage of those, so we won't run out anytime soon. You talked about chance in your memoirs and how chance impacted you, and I know that it was entirely by chance that I came into contact with the program, so I can really appreciate it. But I have a question for you. Right at the very beginning, you talk about the fact that your facility and skills with Fortran were virtually unique among your cohort at university in math, and it prompted in me the curiosity. What was the driver behind you choosing to study computer programming when you were doing your math degree?
Okay, thanks, Jerry. That occurred in my last year. I took a 4-year math degree, honors degree, and I had room for, I had to choose my last sort of set of courses. And the computer science department had just started at the University of Alberta. I have no memory, Jerry, as to why I chose to do that, other than taking more theoretical mathematics courses, which I could have. And I have no memory as to why I chose to program and chose the course in Fortran as opposed to in COBOL, which was the business-oriented language of the day. Probably because I was mathematically and scientifically oriented at that time, more so than administratively oriented, so that I saw a better future for me to work on mathematically oriented problems in a job somewhere. And so I chose Fortran. But interestingly enough, having done that, my first choice and what I wanted to do when I graduated, I wanted to work for a life insurance company. I wanted to become an actuary. and that's COBOL. That's not Fortran. But I couldn't. I was offered a number of jobs with life insurance companies, and the one I wanted was in Connecticut, and they wouldn't give me time off to get married. So getting married was more important. So I chose a job with an oil company, Shell Oil, and I started working in Fortran. So in Calgary, so I could get married at time. But that's all I can remember, Jerry, I'm afraid. Sorry.
Well, just a tremendously auspicious decision, along with getting married.
Yeah, that's right. Yep, 61 years. How long have you been married? 56. 56 years. 56 years.
And time for one more. Ib Johansson.
Oh.
Here comes Ib.
Uwe?
So yes, here I am. I have no camera on my, so you will not be able to see me. But Denis, it was so great reading your memoirs, and I wondered, since I met you 15 years ago, I think it is. It was you have obtained so much and have started this education in health informatics, and the time when you have been in Denmark, I think we met by coincidence, because you have always been so eager and so eager, just trying to find out how is specific countries, how are they doing within health informatics. And I thought we should spend 1 hour together, but I think it took almost the whole day, and you came back again and say, we need to write something about this. And it have been, we have had so many nice times when we have been meeting in Denmark and in Canada and in Spain regarding how the IT system are used within health. And your inspiration and your talk to the Medcom when they have this 20th anniversary, it was so great just to have an overview of what was happening in the world. So I would say your memories, yes, it's more than 40 or 50 pages, I think. It's really amazing. And all the time that you have been using making all these papers, and especially also for the University of Victoria, that you have been a good ambassador for them, I think. So Denis, congratulations with your memories. I hope that we will be in contact in the future too. So the best regard from Denmark and from Medcom.
Thank you very much, Ib. That's very kind. We did have some wonderful times together studying the Danish system, as well as comparing it to the national Danish system, comparing it to the regional Andalusian system. And I learned a huge amount during that process, and I think the same can be said for you. I see that our joint Danish colleague Christian Knorr is connected, and I'd just like to comment. There are so many of you connected. I acknowledged a few of you, but I obviously don't have time to acknowledge everyone. But thank you very, very much for being a part of this. And I think when the recording comes out, I think my wife and I are going to go through it and look at the names and whatnot. And I may be in touch with some of you later on to thank you for being a part of this. A lot of people have influenced my life, and a lot of people have had a tremendous impact on my thinking. And a number of you are part of this call. And from the bottom of my heart, thank you very, very much for all you've done to help me in my career and in my life. Thank you.
Okay, well, thanks everyone, and thanks Denis for all your contributions. We'll be posting this on our website, the session. And if you haven't read the memoirs, get them, and we'll be posting that probably in some form in the online library in the near future. And other than that, thanks for coming. It was really, really fascinating. Thanks, everyone. Thanks, Dennis.